8:17 on this Friday morning. It's been less than a week since Facebook founder Mark Zuckerberg announced that his wife Priscilla is pregnant, and they revealed that the couple had been through 3 prior miscarriages. He said he hopes that sharing their journey will help more people feel comfortable sharing their stories and giving them some hope. So joining us in the Good Day Chicago studio is Dr. Jenny Hirshfeld of the Fertility Centers of Illinois. Thank you so much. Always good to see you.
Thank you for having me.
Let's talk a little bit about this. This is a bold move for the family, for the founder of Facebook and his wife to come out and say, we're pregnant now, but it wasn't an easy journey for us. Why is it such a stigma attached to having that conversation and talking about losing a baby?
I think, unfortunately, as you said, there is a stigma. Women feel a lot of shame. Although miscarriage is so common, people don't feel that other people have truly experienced it. And so I think it's wonderful what Mark and Priscilla have done in the context of using social media in one of its best ways, which is to inform everybody in general, to create a sense of community online so that people know, 1, that they're not alone, and 2, that this is very common.
And it's amazing how he says giving them hope, because they had 3 miscarriages, but they're pregnant now. Do you think so many times when a family or a couple goes through a miscarriage, they feel somehow, I'll never be that woman that's able to continue or to carry a baby full term?
Yes, I think that's why it's so important to do what they have done, to let other people know that this is common and that then you are able to go on to be successful.
And is this more common, Doctor, too, for women younger or women older?
We know as you get older, the risk of miscarriage increases. The risk of miscarriage in general is about 1 in 3 women. As you get older, that number increases as high as 40 to 50%.
Take us through some of the top reasons for miscarriages. Let's talk about that.
So one of the most common reasons that women experience miscarriage is what we call chromosome abnormalities. So we're born with 23 chromosome pairs from our parents. We have to pass those on to our children. If we have one too many or 1 less, then it results in a chromosome abnormality, it results in a miscarriage. There are treatments that are available, such as at Fertility Centers of Illinois, where we're able to screen these embryos to make sure that they're healthy before we place them back.
So don't give up, you're saying.
Don't give up, absolutely
It can
not.
be fixed. Let's take a look at that full screen again, the information that we have for people at home, because you're talking about some of those uterine abnormalities as well. Thank goodness I'm not a doctor. That's one of the other common reasons for miscarriage.
Yes, uterine abnormalities, infections, what we call autoimmune disorders. Those are what we think of sort of thyroid abnormalities are all the most common reasons, but chromosome abnormalities is by far and away the most common.
And what could be some of the medical conditions then out there, doctor, that could cause you to have a miscarriage?
If someone has very advanced or poorly controlled diabetes, poorly controlled high blood pressure, these are all reasons that people can have loss.
But you're saying come on over to the clinic, because these things, if you're willing to have that conversation, open up with your doctor, those things are treatable.
Absolutely. We can screen so we can identify if there is something to be fixed. And even in the context of chromosome abnormalities, there's technology that can be done to screen for that. So there's hope out there, there's help out there. It's important to seek assistance. And
somebody so prominent willing to have that conversation. If anybody wants more information about what you do at the center, what's your web address, Dr. Hirshfeld?
Our web address is fcionline.com, so come check us out and see.
All right, good to see you. Thank you so much.
Thank you so much.
Have a good weekend, and let's keep the conversation going.
Yes, thank you.